FORA.tv. The world is thinking.
So we have a long way to go with regard to improving our healthcare system. And I don't think we ought to live under I would call it a myth that we have the best healthcare system in the world. But I think in spite of what differences there may be in how we describe the current system, I wouldn't think there's any difference with regard to the goal. I think the goal is to have a high-performance healthcare system based on value. And value is access and quality over cost. Making sure we get the best use of every dollar we commit to healthcare in terms of the access and quality that we would expect from the healthcare system today. So how do we do that? Well, I think, again, the Secretary laid out some very, very concrete and specific examples of what need to be done. And frankly, I agree with every one of the examples and suggestions he made. The one he didn't mention a couple of them that I think are very important. I agree especially on wellness. Every healthcare system is a pyramid, where at the base of the pyramid you have primary care and wellness promotion, the cheapest and really the most efficient kind of care. You work your way up until you get to the very top, which is the most sophisticated technological applications of healthcare. Every other society starts at the base of the pyramid and they work their way up until the money runs out. In America, we start at the top of the pyramid and we work our way down until the money runs out, and we pay a whole lot more for the inverse direction that we take healthcare on that pyramid now. So I believe that that is so critical. I also believe that we have to change the infrastructure within our healthcare system, especially for decision-making purposes. As a person who served in Congress in either the House or the Senate for 26 years, I can tell you that we don't make good managers of a healthcare system, but that's what we're expected to be today. Just as we wouldn't make good managers of our monetary system, we delegated that responsibility over 100 years ago to the Federal Reserve. I believe we have to create the same kind of infrastructure for our healthcare system today, delegating managerial responsibility and recognizing the importance, as he said, of having choice. I'm not a single-payer advocate either, in large measure because I don't think you could ever get it passed in this country, even though we should recognize 45% of the people in this country get their health care from a government-driven system today. 55% get their health care from the private sector. But we ought to have that choice. Somehow there has to be a far better integration of that managerial responsibility, and I don't think Congress can affect health policy and managerial decisions any more than they can decide the interest rates that we should have with regard to our monetary policy. The third big change we need is transparency. Our healthcare system is the most opaque of any sector of our economy today, by far. The best example of that is the number that Tommy used. I'm sure most of you don't fully appreciate the fact that about 100,000 people die every year because of medical mistakes. 100,000. Well, that comes out to a 747 crashing every day and a half. Now, if a 747 crashed out here at the airport tomorrow, how long will it be before we get NTSB out here and all of the investigators to tell us exactly what happened, and we go through whatever procedures necessary to make darn sure it didn't happen again? We don't do that in healthcare. We don't use what we call standard of care, nor do we have the transparency to allow us to better understand why is it that 100,000 people die every year. He put his finger on one of the best reasons, and that is we have a 19th century administrative room and a 21st century operating room. We've got to bring the administrative room into the same century as the operating room and use the IT that Tommy talks so eloquently and passionately about. But having the standard of care is so critical. We also need payment reform. And this goes to Medicare in particular, but it really has to be across the board. Today it's on procedure. And if we cut back on the amount we pay for each procedure, guess what? Doctors oftentimes are able to make up in volume what they can't in a unit price. And that's exactly what happens. We need episodic reimbursement, not procedural reimbursement, and that would go a long way to helping address the challenges we face today.